Assalamu alaikum, dear students. Today we will discuss causes of population explosion. Population explosion is excessive rise in population. Two main causes of increase in population are high birth rate and low birth rate, low death rate. High birth rate refers to number of children born per thousand persons in a year. Death rate refers to a number of people dying as per thousand persons in a year. Now we will discuss causes of population explosion related to high birth rate. Child marriage and early marriage number one इसका cause है. Child marriage is a common feature in some backward and obligatory tribes. In rural areas of Bihar and Uttar Pradesh, boys and girls got married at the age between 12 to 15 years. Even during the last years of 20th century, consequently the girls became mothers at a very tender age and their productive period becomes long. In India, 8 girls out of 10 get married between the age of 15 and 20. Even otherwise, women and men in India get married on average at younger age than in the West. Marriage as a social and religious necessity. Marriage is regarded as a social and religious necessity. An unmarried person and married couple without children are looked down upon. A boy must get married at a proper age. It hardly matters if he is able to earn his living or not. Religious thinking considers many children as blessing of God. Almost everyone wants at least one son. According to Hindu religion, the son performs the last rites of his parents so that they are able to attain salvation. Parents consider it their religious duty to get their children married at their lifetime. दूसरा इसमें आता है illiteracy. Illiteracy rate is high in India. Illiterate parents fail to understand the importance of family planning. They are unmindful of their living standards as small family norms. इसके बाद आता है poverty. The poor have a big family due to many reasons. They spend little on the upbringing of their offsprings. Secondly, people consider many children to get a big source of income because children are made to work at a very early age, so large family is not considered burdensome. Thirdly, physical relation is the only source of entertainment of the poor. Fourthly, sometimes people can't afford sophisticated and safe contraceptives and are afraid the sterilization, usually free of cost, may affect their health and earning capacity. In the words of Gunnar Myrdal, in a poor society, children are not burden on the resources of a given family. Rather, They are the source of social security to the family. इसके बाद आता है joint family system. The existing joint family system in India also encourages high birth rate. It is an important source of social security in India. Child upbringing is comparatively easy in joint families. Increasing number of children is not an issue to be worried about because expenditure is made from common sources in a family. There may even be competition among the brothers to have more and more children, especially sons. इसके बाद आता है lack of family planning. Poverty and ignorance deter people from using contraceptives to practice family planning. It also adds to a high birth rate. इसके बाद आता है low status of women. Women have a low social status in India. They are considered merely as child producing machines. They have to depend on men as they are not economically self-dependent because of the lack of education and training. Therefore, they have to please the men in every respect. Physical relations count much. Among the low-income strata, they are respected in proportions to the number of children they bear. A woman without child does not enjoy a respectable social status. Invariably, the husbands of such women opt for second marriage. It also contributes to high birth rate. Now we will discuss causes of population explosion related to decline in death rate, control on epidemics. There was a time when epidemics such as plague, smallpox, tuberculosis used to cause a havoc of mass death in India. After the independence, they have been effectively controlled in 5-year plans. Special programs were launched for the uprooting of smallpox and malaria and plague. नंबर सेकंड इसमें आता है फैसिलिटीज ऑफ मैटरनिटी homes. Facilities of maternity homes in our country has also increased. The number of nurses and trainers midwives have also increased subsequently. This has considerably reduced the incidence of death of women at time of delivery. इसके बाद आता है spread of female education. An educated woman is blessing for the whole family. Literacy among women is progressing rapidly. Educated women bring up the children with hygienic care. They have become conscious of proper care of children, need for age gap between the two children, balanced diet, nutritious food, control of different diseases, importance of healthy life, etc. Due to education, this has contributed a lot in the decline of death rate. Control over fem इसके बाद आता है decline in social evils. Due to impact of education, many social evils like sati, partha, drugging of the children are on the decline. It has reduced the death rate. इसके बाद आता है late marriage. Late marriage has come in vague, especially in the towns. Minimum eligible age for marriage has been fixed 21 years for boys and 18 years for girls by law. It has done away with the evil of early marriage. It has helped in reducing the death rate of women and children. इसके बाद आता है change of habit. Habits of people have been changed. They now attach more importance to health and cleanliness. This has also declined the death rate. इसके बाद आता है improvement in standard living. Despite of still low per capita income as compared to the West, our standard of living has certainly improved. After 1947, people are enjoying more comforts and facilities. There is more nutritious food and better health care for most. Increased awareness has also contributed to it. This too has led to fall in death rate. इसके बाद लास्ट वन आता है urbanization. Trend towards urbanization has become increasing. Consequently, urban population has increased. Towns have more facilities as compared to villages. They are cleaner and ample medical facilities are available. Moreover, urbanities are more aware about healthcare than villagers. Hence, urbanization has also led to lower death rate. This was all about this causes of population explosion. So, in next class, we will discuss role of media, print, and electronic for population awareness. And in next topic we will discuss consequence of population explosion.